to this Monday SURSAC meeting. I'm going to just begin with some of the usual disclaimers. Pull up my screen here. All right, so this meeting is being recorded and live streamed on TVW. It will be shared on the State v. Blake webpage, and it is open to public disclosure, so please do not disclose any private or confidential information during this meeting. If you wish to provide public feedback, there will be 20 minutes designated for public feedback near the end of the meeting today. Each person will have 3 minutes to provide their feedback. Non-committee members will remain muted until it is time for public comment. And if you don't have a chance to provide comments that you want to provide during the meeting, those can always be submitted via email to hcaesb5476@hca.wa.gov. All right, and with that, we'll just move right into the roll call. So I know there are legislative session has kicked off, so we may not have as many of our legislators on today, but we'll see. So I'll go ahead and start with Michael Langer.
Present.
Amber Leaders.
Good morning, I'm here.
Good morning. Senator Dingra. Senator Braun. Representative Davis. Representative Griffey. I know Caleb wasn't able to make it today. Don Julian Saucier.
Good morning.
Good morning. Chanel Wolf. Alexi Orr. Amber Daniel.
Present.
Good morning. Brandy Flood. Stormy Howell.
Good morning, present.
Good morning. Chad Enright.
I'm here.
Good morning. John Hayden.
And I'm here also.
Good morning. Sarah Melfi Klein.
Good morning.
Good morning. Sherry Candelario. Actually, she told me she wasn't able to make it today. James Tillett. Christine Lynch.
Good morning, present.
Good morning. Sarah Gillard. Donnell Tanksley.
Here.
Good morning. Malika Lamont.
Present.
Good morning. Addie Adwell.
Present.
Good morning. Kevin Ballard.
Present.
Good morning. Hunter McKim.
Good morning.
Good morning. Kendall Simmons. Representative Taylor. Representative Mossbrucker. All right, that concludes the roll call. So I'll go ahead and just remind everyone, the norms and expectations are attached to the meeting. If you want to review those, we'll actually be going over those again later on in the meeting today. But for now, we'll just move into agenda item number 2.
Michelle?
Oh yeah, go ahead.
I'm sorry. I just want to take a little moment to welcome people, if that's okay. So we've got all the disclaimers and roll call and such taken care of. But thank you all for being here. Happy New Year. Happy 2023. Happy first day of legislative session. And for those of you that have such interest, I guess it's the happy day after the Seahawks made the playoffs. So pretty exciting weekend for football fans. We are glad you're all here this morning. Thank you for taking the time. I know your time is valuable. And certainly we have serious issues to discuss here today. So with that, we will go over some additional housekeeping and support for the committee. We'll talk a little bit about the plans, the plan as it is, and session beginning. And then Blake is going to lead us through some feedback, additional feedback than what we had in December from the committee in terms of recommendations and patients and so forth going forward. So again, just welcome. Thank you for being here. And Michelle, I'll turn it back over to you. I'm sorry, I didn't even say my name. That was kind of rude. If I haven't met you yet, we do have guests on board as well. My name is Michael Langer. I'm the Deputy Director with the Division of Behavioral Health and Recovery and Chair of the SURSAC Committee. So, Michelle.
Thanks, Michael. So I do have some exciting news. Because of SSB 5793, we are now able to offer stipends for committee members who are not otherwise compensated for their time serving on the committee. So if you are someone who is not here during paid work hours and or you would be part of here because you are offering lived experience and or are would qualify as a low-income person, you are eligible to receive this stipend. It's $45 an hour, so that would be $90 for the 2 hour meetings that we have each month. So if you think you would be eligible for that, please just let me know. You don't need to identify yourself right now. Just email me and I'll get that taken care of for you. So with that, we can move on to agenda item number 3, the plan submission and implementation updates. And so, Michael, I'm going to pass that back over to you.
Sure. Thank you, Michelle. And I know the committee has a strong interest. I'm sorry, it looks like we have a hand up first, Michelle.
Yes,
Sorry.
yes. I don't qualify for the stipend, but some people might. So I want to ask the question, is that retroactive?
It would be starting this month and moving forward. So if you attend this meeting, you're eligible, I will be submitting those stipend requests starting for the January meeting and then moving onward.
Okay, thank you.
Yeah.
Thank you, Don. Okay, so yeah, I wanted to give a brief update on the plan in terms of its formal publication. First of all, I want to say that we don't believe that having the plan formally published will in any way inhibit or reduce the ability for legislation to be crafted. Senator Dingra did have the hearing in December. We are seeing references to the plan in the press as stories are being written about it. We do have some highlights on the website, but currently the formality of the plan being published is still going through executive review. We would expect that to be completed by the first part of February. Let's see, do I want to say anything about that? I mentioned the media picking up on it. We believe those legislators interested have access to what the recommendations are. And that's the status of the plan. As soon as it is published, we will most certainly let you know so you can start making references to it or linking to it and so forth. Also, since we last met, the governor's budget was submitted. And so hopefully you have access to that or have seen the behavioral health components of the governor's budget. We're very fortunate that behavioral health and including SUD was supported in the budget. And now we will see what the legislature does in terms of matching the governor or making whatever adjustments that they will take on that. So we're appreciative of that. Also, there are some bills that are relate to some align with and some relate to the plan and some of the recommendations you all put forward or we all put forward. And so I've been talking with Michelle about making sure that we keep in good communication with you all as members about what those bills are. Similarly, if you hear of bills being submitted and you want to know if we're tracking them or seeing them, you certainly can reach out to Michelle and say, hey, did you guys hear about this one or that one? Michelle, I think you might be talking about this a little later, but we're talking about, maybe sending out a weekly or bi-weekly sort of update to members so that you can kind of keep track of things as they transpire through session. I think that's it. I don't know if there's any questions that have come up, but happy to answer any. Malika, see your hand up.
So we're to understand that this report, the formal report that many members of the public would like to be able to refer to for their advocacy work, et cetera, is going to be 2 months, essentially 2 months behind by the time it comes out. And that people are not going to know what's in the formal document in order to better be able to respond to the bills that will be put forward. That just seems to fly in the face of accountability and in the interest of the public, like having this be a public process. I just want to register that concern.
Okay, thank you, Malika. Michelle, the reference, the section references, overview references is on our website, correct? That was an ask, I think, after the last committee, is to put an overview together.
Yeah, the list of all of the recommendations are on the website, so that could serve as something to link to and reference to for the plan. I mean, the plan is the recommendations as well as a few appendices and other things, but the plan is essentially the list of recommendations that is made public and has been posted to the website, so that hopefully that can serve as a stand-in, in the meantime.
But you are correct, Malika, that the formal plan is not published and continues to go through executive review. When it is published, we will let you know as soon as possible.
As of last Friday, folks were still not able to find anything on the formal website. Just wanted to give y'all that update.
Okay. Well, we will definitely check into that, and we will send out to the committee the link to the site that has it on there for sure. Other questions? All right. Again, we will anticipate quite a bit of activity related to behavioral health, and particularly SUD, this session. So we'll do our best to keep you apprised as new bills are submitted. Michelle, I'm going to turn it back to you. Or Blake. I go to Blake.
All right. Thank you, Michael. Appreciate that. Good morning, folks.
Yeah.
Michelle and I put together a small slide deck here, prompting the group to talk about what we're going to do with our meeting time. The group had asked to meet monthly, and we have some predetermined activities, and Michelle will show you that slide deck here. Actually, Michelle, you can show that anytime. Some predetermined activities, but we do have quite a bit of time that we want to get your feedback on what we want to do with that time. And so, Michelle, if you wouldn't mind, the first slide here, we just want to show you is for your information, on the second slide rather, is our cadence right now and types of meetings. Michelle, you want to explain this one, please?
Yeah, certainly. So one of the things that the SURSAC has been charged with is to review the quarterly reports for the Recovery Navigator program. And so since those reports come out on a quarterly cadence, we've got quarterly meetings set aside for review of those reports. So those would be on March 6th, June 12th, September 11th, and December 4th. And then I talked to Brianna about how early to how late we can be reviewing the annual report. And so the early draft, we should be able to review September 11th, a revised draft on October 2nd, and a final draft on November 6th. So we wanted to note that those would also be items for our agendas on those dates. We have an R&P presentation scheduled for our next meeting, which was requested during the December meeting. And so that's what we've got laid out so far already. So what we'll be talking about, later on in the meeting is how else we want to spend this meeting time and what it will look like, what you want it to look like as we are implementing the plan and taking steps to do what we're able to with the recommendations. So any questions about the schedule? Okay.
All right, thanks, Michelle. Appreciate that. Next slide, please. So we asked for some opportunities for improvement or where we could improve here in our organization and just general meeting, topics and so forth. We did that through Menti on, I believe it's the 5th of December. And so I just want to roll through those real quick and make sure that you're all aware of those. So advocating for more widespread acceptance from our community partners, including law enforcement. We will increase referrals into treatment services for all individuals suffering from substance use disorders, understand the plan and how we can jump in to help clients, creating respectful and inclusive policy processes of HCA, bolstering the public health response while tamping down the legal response, give some power back to the police regarding actual crime while they are trained to refer according to the Recovery Navigator program. Diversity, equity, inclusion was a big topic, and then we'll talk more about that. And then more harm reduction policies in place, more policies centered on the point of view of lived experience folks, policies that really support safe supply in our state. Bring law enforcement to the table. Create a step-by-step plan to help people who are in justice justice involved. Drug courts, expunging records, DASA document clients from the prison, engagement with the lead model, telling more stories that the law enforcement understand that these works are not new, increased access to methadone statewide, a statewide roadmap for removing stigma, and record of criminal charge for the disease of substance use disorder, and then more family engagement. So that's what we came up with our last session. We want to add more to that now here. If we go to the next slide, not necessarily going to be able to see that last one, but as those are the things that we wanted to do. So as we move to, actually it's 2023 to 2026, we have the committee charge for 5476. Says HCA adopts rules in accordance with the recommendation of the Substance Use Recovery Services Advisory Committee as provided for the SURS plan. And then the second bullet, SURSAC provide review and consultation to HCA. And so that would include an annual substance use recovery services plan, that report, and quarterly reports for the Recovery Navigator program. So with that, I guess what we said with our opportunities for improvement and with our charge here, what do we want the process of making this happen to look like? And I know it's a pretty general question, but we added the things that we wanted to, that we said for improvement. And again, we want to get everybody's opinion on this. If you don't, even if it's just to agree or maybe disagree with the bullet point, but we all kind of want to talk, if everybody wouldn't mind chipping in on this one to give us some ideas about, about what you want to look like here going forward and the improvements we want to make. See one from Malika already. She said, it seems HCA should be more transparent about their challenges to meet the requirements and lessons learned in the interest of accountability.
That was in response to Michelle, not necessarily to the question.
Okay. Well, it might be good anyway, right? All right. So anybody else? What do you want to see in the upcoming time? Again, when we have these meetings, some of the meetings we're going to have that are going to be filled with reviews, and some we're going to have a bit of time. I'm patient. I can. Okay.
But hold on, sorry. this is a committee member conversation. Deontay, if you could hold your comment for public comment at the end of the meeting, that would be appreciated. Thank you so much.
Oh,
We definitely
yep.
want to hear what you have to say, so please hang on to that.
Thank you for that reminder. Julian.
Yeah, so I'm one of the newer members. So I'm not sure like what processes we're out to kind of be supportive of the members or information that they have, like the vast experience of all the committee members. Because I felt like the presentation to the legislator, the subcommittee meeting was kind of dismissed the experience of people and all the other vast experiences that people have versus just being a lived experience, but also, you know, experience helping people and experience in the community. I just felt like I wish we could do something to show more support for like who's involved and that we come from many different facets of experiences in life, and things were well thought out in both committee meetings and subcommittee meetings. I don't know if that's related to this or not, but.
Yeah, thank you, Julie. That's great feedback. I just want to make sure that I'm capturing it well. So did you say do something to show support for like a wider range of community members? How would you phrase that?
But like I just want to show like that people like if I have a lived experience, but I also have like other experiences. Like there's like bios or something that shows like what the group's doing other than I felt like it was kind of ill-defined in that some ways at the end of that meeting. So I want to make sure that
so showing what committee members are doing outside of the committee activities to support.
Yeah, that we have subcommittees
Okay.
that people have other experiences other than just the one that they're assigned to in this space. Like people that are on some committees also have a lived experience. Some people have, you know, just to show like this is a good group of there's a great group of people. I like to be put forward, you know.
Yeah, I think one thing you're bringing out is last December, or a year ago in December, when we first convened, we had an opportunity for members to share a bit about themselves. And I think as new members have come on, you're not getting the benefit of that sharing, it sounds like. So thank you for bringing that out.
Okay. We'll go to Malika, and then we got a couple comments here.
In alignment with what Julian has said, I think that going even further than that, one of the things that has been extremely frustrating to me throughout this process is that it seems the person, Michael, maybe you can answer this for me, Michael Langer, how you became the chair of this group when there are, you know, people that have been impacted by these systems that we're talking about. I'm not erasing your experience if that is something that you have lived experience of. However, the voices that have been uplifted throughout this process, to Julian's point, the people that were invited for the most part to testify at the legislature met a certain demographic of individuals, and not to erase anybody's ethnicity, but I think that everybody that testified appeared to be white. And there were a lot of system players that were invited to participate in that process. The rest of the group wasn't made aware of it. And I feel like there needs to be a more equitable and representative process for who will be the chair of this particular group, or that there'll be a co-chair or tri-chair model in the interest of equity. And I also think that it is pretty concerning that we weren't communicated. What I think I already said this, but I'm going to say it again, that we weren't that we weren't like, we didn't know that there was going to be that hearing. Nobody knew about that until after it happened. And it just doesn't seem, some of these actions really seem pretty close to intentional to exclude people. And it was really concerning to me that I think it was Prosecutor Enright who brought up that folks that have been involved in the process, this whole process, still can't tell the difference between decriminalization and legalization, but they were ones that were speaking on behalf of this group. And that's a problem. So I'm curious, Michael, how would you be open to, is it possible that there would be broader representation in the chairing of this group?
Yeah, so thank you, Malika. A few comments back. In terms of the hearing that the senator held, the question came in about who would be best to present on behalf of the subcommittees, the recommendations. And so as a state, we recommended that the non-state partner be the individual that made the presentation based on the subcommittee, so the co-chairs. So that's how that took place, and the invitations went out from the senator's office for that. I was asked at the end if I would give sort of a recap, not the end, but at the beginning, if I give a recap of the process, which I did as the chair. In terms of the chair, I was asked by our HCA director if I would chair this group, of which I accepted. And as HCA was asked to staff it. And in terms of moving forward and being open to co-chair or tri-chair, I would be more than willing to take that into consideration, and if that's something the group wants. So I think I hit them all, Malika, but if I missed something, let me know.
Okay. We'll go back to Donnell's comment, Tank's comment about regular legislative session updates with regard to 5476. And if there is a question from the legislature who is answering those questions from this committee, I think that's just, want to know what the questions are. I take that, and Tank, speak up if I'm wrong. We want to know what the group wants to know what the questions are, who's answering them, and obviously what the answers were. Is that accurate, Tank?
Absolutely, Piz. I would think probably starting this week or even before the session started, that there may have been some questions considering the hearing in December. So, as a committee, I think would be helpful at least to keep a running tally of different questions that come to this committee with regard to what they might do, or any questions they have for us, or any follow-ups and things of that nature. And I don't necessarily think that has to wait until the monthly meeting either. So, perhaps maybe that could be just a note that's sent out.
Okay. And that goes in a way with the other comment too, around just making sure that we're known who's doing what, who's testifying, those kind of things, and are aware of that before. All right. Thank you. All right. I see a comment from Malika. I'm not sure if it's speaking to this, but yeah, we did have the public comment at the beginning, and now we're doing it at the end. Okay. And I'm not sure that the public knows that point. I'm not sure the public knows, as I am unclear if they have an access to the agenda. You want to speak about that?
The agenda is always, doing our best, and now from now on, always posted at least a week prior to the meeting on the website. There's also the SURSAC newsletter that we'll be talking about later on in the meeting, where we'll be sharing the links and potentially also the agendas there as well, so that it's a bit easier to receive over email than to have to go to the website, right? So trying to make that as easy as possible for people to access.
Okay. Kevin.
Thank you. Happy New Year, everyone.
Happy New Year.
My comment relates to the communication process. We made a number of very impactful votes last year related to policy we're putting in the report. I'll speak for myself. There were issues that we voted on that I did not have a lot of experience in, that I needed follow-up information. The means by which HCA facilitated helping me get further information involved HCA reaching out to subcommittee members or people that had proffered the policy, and they said, please respond to Kevin's question. Well, what ended up happening was, the questions didn't get answered. And it seemed like if those that were, everybody's busy in life, I get it, but these votes are important. So if HCA is involved in the communication process and they CC those individuals, I would like HCA to follow up, because it's important we receive all the information we need in order to make informed decisions.
As far as note-taking goes, Kevin, can you help me with just a short summary of what you want us to take down with that?
HCA, follow up and ensure all questions addressed to subcommittee members are answered to the extent possible.
Thank you.
Other comments, ideas, please. Sarah.
Yeah, we talked towards the end of, when we were wrapping up our recommendations about centering the voices of folks with lived and living experience. And I don't know that I know all of the ways that we can best be positioned to do that as a group, but I know that meeting times were an example given. Additionally, I know that when we were working on the recommendations, there was sort of a time crunch. And so folks who wanted to come and share their experience towards the end, when we were trying to get those out quickly, it felt like their voices were silent. So if we can kind of plan proactively for bringing those voices in and to the table early and often.
Thank you. All right, Hunter.
Hey, good morning, everyone.
Morning.
So my comment here isn't quite related to the process really, but it's kind of been tickling at my brain since Deontay raised his hand. And I understand that he's more considered a member of the public here. But I've noticed that he's at these meetings a lot and has a lot to say. So I'm curious if there's any exceptions we can make at times, for members of the public who are here a lot. Like for example, Deontay. I'm always curious about what he's gonna say, and I'm curious if we could adopt some sort of position for him so that he could speak more. I think that would be pretty neat.
All right, thank you, Hunter. Malika, you're up next.
In alignment with the last two comments, people with lived and living experience need to be centered in this work. And to my knowledge, a number of people that work within the HCA structure and the DOH structure are individuals with lived and living experience. However, they are not invited into this process in a meaningful way, let alone members of the community. And when we brought them in, they've had, frankly, a hostile reception. So I'm really hoping that we will have more of a role in determining what the agendas are going to look like, and how, and the information and that we actually get the information that we want from individuals that would be able to provide us with strong input in order to make these policy decisions. Because frankly, over the last year, it has felt like a lot of these agendas have been pretty weak. So until the very end, after we had to throw a whole entire fit in order to get the information that we wanted in special sessions. I'm hoping going forward, we will not have to do that, and we can do it throughout the whole entire time.
Just to follow up real quick with that, Malika, I would love to hear more about what you want that process to look like in terms of agenda feedback. In a previous email to SURSAC, I did ask for ideas or for items for this meeting. and plan to continue to do that, to get feedback from SURSAC members. And I didn't get any feedback, so I would just really love to hear more about what kind of process would work well, would work better. Maybe people just didn't see that, and I need to make it more obvious or something. But what would work well in terms of being more influential, having more control over the agendas?
I think that probably after a year, we didn't really take it seriously, that we were being invited into the process. And also it happened during the holidays when a lot of people were on leave. So I'm hoping going forward that we can have active conversations, even if it's at the end of these meetings, before we go into public comment time, when we ask people, who do we think is missing from the table? What do you want to learn about in these next sessions? I think that it's a continuing and ongoing process. It's good practice to always ask folks what it is that they want when you have their attention and when you have them in front of you. And also sending things out in email as well. And that in the work groups, I don't know if the work groups are going to continue to move forward. I doubt that they will, but they might. That was where more of the substantive policy conversations were occurring, but not everybody that was involved in this decision-making body, and I say decision in quotation marks, decision-making body was deeply involved in all of the work groups. So I think that going forward, having a more cohesive process where you're asking people when they're gathered here, as well, not just sending an email out.
Yeah, that's really helpful. Thank you so much for that. All right.
All right.
Yeah.
Stormy.
Thank you. I was just going to say, if we're going to be reviewing Recovery Navigator reports quarterly, I would really like to have some of the people that are on the ground, part of the Recovery Navigator teams, coming and providing information. I think we can get a lot of information from reports, but I think there's a lot of information beyond the reports that would be useful to have. And I know programs look a little different all throughout the state, so it would be really great to have that information to put the reports in a little bit more context and be a little bit more informed. Thank you.
Yeah, and sorry, Susan, given our current process, we're just gonna have to wait for members of the public to make comment till the public comment period. So hold on to your comment, please.
All right. Thank you, Susan. Amber, did you want to say something? Yep.
I think Stormy had her hand up before me.
Oh, I think Stormy made her comment.
Oh, okay. Yeah, so following up on the comment about the RMP quarterly reports, I do the quarterly reports for my organization, and I know that they're due by like the 10th of the month after the quarter ends, and I'm just curious how we're gonna have live data at the time when we have them scheduled to go over. Because I know my stuff is going to go to the BHASO, that's going to go to the state, and then you guys are going to, have all that stuff. And sometimes our meetings are going to be before that day, and sometimes our meetings are going to be very soon after. So I'm just curious if that's a realistic time to go over quarterly reports. How fast you guys
so let me
go
back. Yeah, Amber, let me go back to the slide to just point something out real quick. So March 6th, that's the 2022 Q4 report. So the data is coming in January. Yeah, so they're all about kind of a quarter after the actual quarter we're looking at, if that makes sense. So hopefully that, yeah.
You're awesome, thanks.
Yeah.
All right, again, we'd like to
out.
I'd like to hear from as many people as possible on what how we're going to get there, what you'd like to see in the upcoming meetings. So please, other comments would be fantastic. Are we going to go again?
Yep, we are. So I did put something in the chat about news and media presentations that the HCA will be releasing. And I'd be interested in seeing those things prior to that happening. I know that in my area, when we did do the Senate Advisory Committee, like local news media reported on it, but the only thing that they showed was Chad and Wright's comments. And there was none of our stuff shown there. And I just don't know what that process looks like. I know that they report whatever they want, but if we aren't putting together formal releases and presentations, maybe we should be. That's all.
Can we catch that last bullet as well for maybe formal presentations? Or thank you.
Blake, can we ask Amber to clarify that one too? Amber, it sounds like there's two things. I don't know if you want, like if we see news articles, if you want us to share those with you, or
So,
if you, I heard you say you want us to
HCA
share the ones
have-
that we would publish, but
Right. Are we doing any sort of media or news presentations or releases about the Recovery Navigator program? Is the HCA doing that? And if they aren't, should they be?
okay, yeah, got that. Thank you.
And then to what extent are we going to be a part of that process? Like, do we get to review it beforehand, or, maybe say the things that we think are important as people on the ground that are working in this field, and, make sure that, because I know we all have things in our own areas that are really prevalent and really, like in my area is very rural, we have really big gaps in services. In the cities, there are other, issues. And I just wonder if it wouldn't be smart thing to create some sort of presentation for the media, and a couple of them, like broad spectrum. I don't know. It really bothers me when I see one-sided media coverage.
All right. Thank you, Amber. Appreciate that. Hopefully we caught that.
Yeah, I think so. Amber, let me know if that last bullet is what,
Can you
accurately
scroll up,
captures what you were
because
getting
my
at.
little toolbar is blocking half of it.
Oh. So it's to the there's a couple things. HCA should share news and media related to SURS plan, SURSAC work, right? That was one part of it. And then to the extent possible, inviting SURSAC members to help inform media from HCA related to the RNP and recommendation implementation. Is that good?
Yeah. I mean, like, and part of it was a question, like, what is the policy right now around that? What is HCA's policy right now? Like, what is your process around, media and news presentation and release? And is there anything, or are you just kind of letting them do whatever they want with it?
So this is Michael. We do have a communications division within the Healthcare Authority that, as press requests come in, we coordinate with them in terms of our response. If there is something that we want to issue, like a press release or convene a press conference, then we also coordinate with them. Yeah, I'll stop with that. But we do have support in that way, Amber, if that's what you were asking.
Okay, yeah, I was asking that. And also, I would just like to say it'd probably be smarter to get ahead of that stuff and show the good work that we are doing.
Yeah, there have been opportunities for us to, in different programmatic areas, to put together sort of local press releases that the local communities can use for their weekly papers or their online papers, things of that nature too. So there's a variety of strategies that we can undertake in terms of communicating with the public. So thank you for the idea.
And one more thing, and then I'll be done for sure. I just want to say I know that there's like pushback from the public and like politically and stuff about like, is RNP going to work? And we're getting a lot of flack, not getting a lot of time to implement things, or, schedule and stuff like that. So I guess I'm just trying to say that I would like to see us get ahead of that, especially with RNP and this plan, because it's real easy to start programs with, the government, and then they just want to cut them after a really short amount of time. And I don't want to see this happen because it's really important work.
All right, thank you, Amber. Julian, and then Malika.
Following along this same line of inquiry, like, is there a way to make a list of people that are from like each region that can respond in addition to the chat and rights and stuff like that? Like the HCA can have people that can be like, if they call and request to talk to somebody, like, who do I talk to? That we have that both regionally and experience wise a little more balanced, because I feel like the lowest vote is the one who's getting all the media right now, and and people voted based on a lot of different talks, subcommittees, and experiences. So I like to see it supported in a way that there's talking points for this, and that we're out, necessarily responding and reporting to things, and maybe a repository somewhere of like of the media that's out there, like the stories that are being told, so we can respond to that.
Yeah, I think talking points is kind of a key. That one.
Yeah, I agree.
Thank you. Thank you, sir. All right. I'll see it real quick before we get to Malika. Brandy made comment. Is there anyone who can collect the list of criticisms folks are making about RNP work? I'm not sure, but good question. I don't know if we have any comments back on that, as well as compliments. There we go. Be nice to see them both. Thank you, Amber. Just maybe something to note here, see if that's possible. Okay, thank you. Malika?
So I just want to draw attention to the fact that HCA elevated the voice that there's criticism about regarding Chad. I know you're on the call, so I'm not going to talk about you like you're not here, but the prosecutorial position. And I think that, to me, that is a larger reflection of how systemic choices made by individuals within systemic institutions or institutions that create the system. Sorry, I have a really bad cold, so I'm not thinking super straight. Anyway, but they are the ones that are choosing who speaks and who doesn't speak, and who gets uplifted and who doesn't get uplifted. And I think that, as the media will do, they take things out of context. And it seems to me, if DEI is something the HCA is actually interested in, it would make sense to put together a media packet with multiple people, not just the chairs of the groups, but multiple participants within the SURSAC, and then have that be released. I mean, if Vocal Law can do it, I would certainly think that the behemoth that is HCA can get it done too. So I would just like that to be, if we're thinking about equity, and also, like, is that in alignment with the governor's guidance around equity? Because one of the things that I've learned is that there is a DEI strategy and plan out of the governor's office. So I'm just wondering how HCA is interacting with that.
So we are definitely doing some DEI work at HCA. It's actually pretty extensive. I don't know if we have anybody actually speak about that, but we can get you some information. Go ahead, Michael.
Yeah. No, I was going to say, if that's something that the committee is interested in, we could have someone, come in and talk about from the governor's perspective and the agency's perspective. We, as HCA, do have pair committees, and the divisions have committees, and we take our DEI work very seriously, and belonging work very seriously. So, yeah, I'll stop with that. The only other thing is, sometimes we are asked by the legislative branch to share who members are and who providers are, depending on what the topic is. But we, as an agency or the executive branch, don't determine who the legislative branch brings in for testimony or ask for testimony. So I'm not saying that there's not conversations happening and that we don't get asked periodically to share what we know, but they make the call on who they want to bring in for the formal testimony. And then, of course, there's public testimony that many, if not all of you, have been part of over the years. So.
Malika, as far as where is the DEI plan, though, I think we've submitted ours to the state, our pair program, and they're putting that together now. So we have a plan for HCA. Whether I'm pretty sure we can share that, but I'm not absolutely positive. So
we do have a plan. We also have a external group of individuals that give input into the plan or help contribute to the process and such. So we can share that at a later date.
Okay, thank you. We'll definitely want to make a note to remember that. Thank you. Okay, Sarah.
I think there were some great comments about process and, process improvement at the last meeting too. And I'm pulling actually directly from those notes, and I can drop this in the chat as well. But someone said, moving forward, it would be helpful for SURSAC to be framed as a multidisciplinary group that is teaching each other, listening to each other, and learning together to create solid policy. As Julian and so many others have pointed out, there's so much experience in the room, even beyond kind of how we're represented on SURSAC. So being able to teach and learn from one another in that way would be fantastic. And Dr. Fatinos additionally shared, excuse me, I'm getting over a cold as well. Dr. Fatinos additionally shared an idea that would lead to more equity in chairing the committee, similar to what Malika had shared earlier. So I can drop those in the chat. I think as it's written in the notes is better than I could possibly say it, but I just wanted to elevate those ideas from last meeting.
Thank you, Sarah. Yeah, we're going to be taking a look at those as well. But yeah, let's put them on the list. Thank you. Okay. Anybody else on this? I mean, we have one more topic that we want to get into DEI a little bit more in depth. All right, Lisa, I see you. We'll see if we can get that shared. Sarah, did you have another question or comment?
Oh, no, sorry. I just dropped those notes in the chat.
All right, all good. All right, appreciate that. So we can pull those out. Thank you. Anybody else have comments on this? So again, we'd like to hear from as many of our committee members as we can. We do have time today, and we'll have time for public comments. We see some folks have some things in the chat there they might want to talk about. So, but anything more on this? Hunter, go ahead.
So, I have a question. So I'm curious: is this time an opportunity to throw out some ideas for discussion topics, or will there be another time to do so?
I think now is as good a time as any. Correct?
Mm-hmm. Yeah. Just to give a little preview of what's coming up in case someone did want to hold on to something. The next slide is about additional objectives in addition to reviewing the reports and HCA implementing the recommendations. And then any feedback you have around, communication between HCA and the SURSAC would be for this slide. And then we're going to go into a full conversation on diversity, equity, inclusion, reviewing feedback that we've heard already and really getting solid on how we want to implement that in the committee. So that's what's coming up. But if you have anything on process, this is the time, and then we'll move on to those other things.
All right, for sure. I guess by the sounds of that, then, is it okay if I give a couple subject ideas? For sure. See, I've I've had two things in my mind for a bit. I guess the first one, I've been kind of thinking about public safety. Um, I did email a couple of you guys regarding this topic, and I think we've done a really good job identifying how we could help people who are living with substance use disorders. And I also think that it could be really beneficial if we give some attention to like public safety and maybe the state of our streets around Washington, like how we could encourage recovery, while also not criminalizing people, but also how we could keep the rest of our citizens safe, and feel like they could go outside and walk around. Um, and then another subject I've been wanting to bring up and have briefly brought up in the comments before, was the topic of an herbal drug called kratom. I know I've mentioned it before in the comments, but I think some verbal discussion could be good so that people could express concerns or support or any questions they may have about it, because it's something I think that we could really bring to the table and maybe find some positivity in for the future. So yeah, thanks for letting me express those.
Yeah, you bet, Hunter. Appreciate that. Thank you. Okay. Randy.
Hello, how are you guys doing?
Hello.
Happy New Year.
Happy New Year.
I'm not sure if I'm saying this part right, but I would love if we put something in here where the SURSAC committee, we're making a statement or a declaration about how we feel about what we need to do about overdose prevention or the rate of overdoses or something along that lines, and something regarding kind of a state of emergency for the blues that are kind of responsible for all the overdose that's happening. I don't know what that should look like, but something in that area that makes a statement about who we are and what we want to do around that across the state, because we're having more and more overdoses due to these blues.
All right, thank you. Okay, so it's a nice list of things that we want to work on here for the upcoming sessions. Any last call, I guess, for this? There's a question from Sarah saying, are we starting the Safe Supply subgroup as part of SURSAC's work this year? Do you have an answer?
Yeah, so I'll just give an answer to that, as well as some of the other things that may not be as legislation dependent as others. So we are in the process of looking at the different components of the plan and specific aspects of the recommendation that we can take some action on. The Safe Supply work group is one of those things that we're taking a look at. So we're just looking at our current partnerships and what's available in funding opportunities to help support the work, and hopefully we'll be able to provide an update for you around those things that we can do prior to the end of session, in the next couple meetings. So yeah, thank you, Sarah, for that question.
Okay, part of that is we should make a statement, Randy had said as well, about our goals for Safe Supply. I think that's, they go hand in hand. Thank you. Okay, let you type that out. Okay. So should we move to the next slide?
Yeah.
And what are we asking here? If you can kind of just explain what the ask is here.
Yeah, so I think this comes back to Malika, your comment from the last meeting, and I think Sarah, you had reiterated this, that to above and beyond SURSAC's role as providing consultation to HCA with the recommendations for the plan and the RNP reports and the annual reports, what else, such as, utilizing this space, this group for having like policy conversations on a wider level, do you want to take on as a committee? So we've got the things that are mandated by the bill, and then, if the committee is willing and wants to do, go above and beyond those things to use this space for other objectives, that's what this conversation is about. So we've heard a bit already before, like, Brandy, your suggestions to come to statements or declarations about specific topics, that would fit in here. And so I hope that makes sense. But anyway, opening up that conversation.
So yeah, we've talked about what our charges and how we want to go about that. What else? What else do we want to from interested from what else, excuse me, are we interested in doing beyond what we have to do? Julian.
Yeah, I think it'd be really nice to teach strategies to talk about stigma, strategies to talk about like just basic communication skills and topics, like just how and a little bit about how the legislature works as well, legislation works, and like lobbying, I guess, and I had one more. I just can't think of it right now.
All right, we can come back to you
So
if you remember it.
The myth of the myth of rock bottom, like the belief that everyone has to hit rock bottom before they can recover.
Myth of rock bottom. Okay, great. Thank you. Appreciate that. And in the comments here, another plug for, is it possible to open up the group to other participation from interested, supportive, and concerned, and both members as well? So just another, kind of another plug for, can we get more people involved and directly in the process? And then also Samantha made a comment when Julian was talking there about some training around just these things here, stigma and so forth, and that we could possibly leverage. I had heard before in the group that we talked about that kind of notion of, getting ourselves informed, I guess, teaching and maybe we can, if that's all right with the group, put that on this list as something else that we might want to accomplish. Is that all right?
So can you repeat that? Like to have,
yeah,
was that specific to Washington Recovery Alliance or
just no, in general, if topics going to come up, just kind of, teach backs or whatever we want to do. So we have a lot of informed people here, and that's very true. And, teaching us about what they may, bring to the table and, different aspects of again, I'm saying this just because I thought I heard it before. If it is not what you want, then I don't want to interject here, but opportunities for teaching and learning. What else? Now, we talked about the stuff that we had to do, what our charge was. Again, this is talking about things that we want to do, given our time and our collective knowledge. All right, Amber, go ahead.
I guess I'll just say again that like it would be really nice to involve SURSAC members in developing the public face of the plan, as and also to have to be in in process of developing those talking points we were talking about.
Thank you. Other comments? Somebody hasn't made a comment yet? I'd love to hear from you. Well, I would suspect that if we have ideas pop up later, Michelle, we can send them in.
Yeah.
Okay, and we can add them to the list. Amber, did you have anything more?
Negatron.
Okay, thank you. Not quite yet, Leo. We're gonna get to here after a couple more slides, and we'll get to the public comment. Okay. All right. So next slide, communication. Michelle, you want to?
Sure. Yeah, I just wanted to. Yeah, I just wanted to. Have a conversation around communication, particularly because once monthly meetings may not feel like enough of an opportunity to be having back and forth around different things. And so just want to know what it is that would be supportive to you as committee members in terms of the emails that you want, like what should be communicated via email, and then what we need to be saving for the meetings. For example, Malika brought up like agenda setting would actually be helpful to include at the end of each meeting, so we can talk as a group about what we want to see in the next meeting. So that's super helpful. And this is the summary of the strategies, the process that we have right now. So I just wanted to open up conversation around any adjustments to this or comments about this that would support strong communication between HCA and the committee. So we've got the member emails. I'll continue to send agenda item requests at least 2 weeks prior to the meeting, so we can get the actual agenda posted at least a week prior to the meeting. Also sending notifications when members are speaking to the legislature about recommendations, or when there's other media, coming out that folks may be interested in, now that we've gotten that feedback. And then sharing legislative updates relevant to the SURS plan, Blake work more widely, and additional intersections of behavioral health and criminal legal systems. We will do our best with this. It's, bills, there's gonna be a lot around that. So apologies in advance if we miss one, but we're gonna do our best to keep you posted around the legislation around those topics. And then agendas and meeting notes, as we've been doing the whole time. So there's that. And then I just want to also bring attention to, we've created a Gov Delivery listserv for SURSAC, so that community members can also be getting some of the milestone updates. And this will also include the meeting links, so people can get the team links to attend, the TBW link to watch, and then also the webpage to find the recording afterward. So trying to make it as easy as possible for folks to stay informed about these meetings and the work that you all are doing. All right, so with that, just want to open up to any feedback around communication strategies, and what else you'd like, or what's even just working well so far.
I think we lost the deck. At least we did on.
Oh no!
My end.
Oh yeah, let me just pull it back up.
Thanks. All right. Thanks. So your question was again for the group? Sorry.
Yeah. So if this, if our current communication strategies are working just fine, that's great. Just wanted to open up a discussion around any additional feedback that you have, any adjustments any of you would like to make to the way that things are being communicated. But this is the current plan and strategy. So
go ahead, Sarah.
Thanks. And this is more around kind of how the communication is framed. I know that, there's a desire to frame things in a strengths-based way, and we certainly want to hear about the successes and things like that, but also just communicating when there are challenges or hiccups or, we're not able to meet timeline, and being clear about kind of what those barriers are so we can learn from experience would be a helpful, I guess, guiding principle moving forward. And I think several members of the committee have said that they'd appreciate, kind of more transparency around, what's challenging and where we can kind of make some adjustments.
All right, thank you. Other comments, ideas? Thank you, Amber. Anything else on this? I think we did cover kind of a lot of this in that first slide too. Kind of,
Yeah.
We covered a lot of what we want to see in there. So,
Yeah.
anything else on this? And again, if you think of something here upcoming and you're like, oh, that's a good idea, then we can send it to Michelle and we'll get that information as well. Okay. All right, let's go ahead and then shift to our discussion on DEI here, principles and approaches. And we heard a lot of in the feedback that we asked for, and we heard there's a lot around people with lived experience and getting those people to the table. So just a couple bullets here. Obviously, this isn't all inclusive. This is just a general summary, but
and sorry, Blake,
Yeah.
sorry, I just want to clarify, this isn't feedback that we've heard directly from SURSAC. This is, there's a couple slides here of discussions that we've had with community members as we've been trying to figure out on our own end, how to do better with DEI strategies. And so I wanted to bring forth what we've heard and learned so far, and then have a conversation with the committee about which of these strategies will be a good fit for the SURSAC to actually implement and agree on as a group, and then adding in anything else that that you want to do to improve this part of our process. So I can go over these couple slides, and then we can open up to discussion if that sounds good.
Sounds good.
Okay. So we received some feedback in kind of two different categories. So there's like general principles and approaches, and then there were specific strategies that that we heard as well. So in terms of the principles and approaches, it's important to invite people with lived experience to the existing tables where the work is being done, rather than creating separate spaces or separate tables for the folks with lived experience to share. Also important to make getting to the table as accessible as possible. And there's a distinction between the public and those who are directly impacted by the policies that we're discussing. Not everyone who is part of the public is equally as affected or as directly affected or impacted. And then also it's important to allow for flexibility in agendas. So we're able to prioritize hearing from people who are directly impacted when they are able to be present and share their experience. And then as far as specific strategies, yeah, public comment. So we've heard put public comment at the beginning because there's less waiting time for those who want to share. We had also heard that public comment at the end can be better so that people can comment on what had been discussed. So so we want to definitely nail down when is best to have public comment, because I know it can be confusing to have it, bouncing around from beginning to end. Something else was include the email address in the YouTube description below the meeting videos. So we're doing that from now on. It's part of the video template. So folks that watch the videos will have that as a reference right there underneath the video in case they want to provide feedback. Post the agenda at least a week ahead of the meeting so that folks can have a time to understand what's on the agenda and prepare their comments. So we are doing that as well. And then here's what I'm interested in hearing folks' feedback. Invite feedback inside of each topic instead of only during public comment. For example, are there any directly impacted folks on the call who would like to weigh in on this topic? Another one is having facilitator awareness and mediation, which is needed around others' responses when vulnerable experiences are shared to create an environment of safety and respect. Meetings that are later in the day can be more accessible. We've also heard that mornings are better. So for simplicity's sake, we're opting for morning meetings, but open to feedback from you if you have any on the time of meetings. And then provide compensation for those who attend, committee members, but also others. So as I mentioned before earlier in the meeting, we are able to offer the stipend to committee members who are not otherwise compensated for their time being here. And I'm waiting to hear back about whether this could also be applied to folks who are not official committee members, but involved in the process, and guest speakers or guest consultants, that are able to share their experience as well. So with that, and you've all got copies of these slides, so I'm going to go ahead and move on to the discussion note-taking slide. But if you want to refer to all of these notes in your own copy of the slides, please feel free to do that. Okay. And then I'll pass it over to you, Blake, for discussion, and I'll get started with notes.
All right. So what DEI strategies, these and or others, do you want to incorporate in our SURSAC work? Just real quickly, Amber's comments about how maybe we have 2 public comment, kind of like we talked about, like you talked about, Michelle. So why does it have to be 1? Good question.
Mm-hmm.
Or yeah, there's something else like now comment on after the subject, something like that. So okay, how else can we be inclusive? Concentrate on our equity and diversity as well. What other ideas are out there? Malika.
That there be multiple chairs to this group, the opening up the leadership of this group, and that they all have equal say.
All right, thank you. Anyone else? Again, we like to hear from as many people as we can, committee members as we can on this. Anything else that we can do?
I'm gonna jot down Amber's chat comment here about liking the idea of asking if anyone is directly impacted at different topics.
All right. What else? Lika, did you want to add more?
I was just going to put it in the chat. Can we please include all the recommendations that were made earlier in the conversation, please?
Yeah, they kind of blend together a bit from the first discussion. Yeah, those ones. Donnell, okay.
Sure. I think someone had mentioned this earlier, since we do have some new people here, but I'm not much about titles and things of that nature, but in this type of work, I think it is important to know what work people do that's on this call. So, and then also that leads to having different visitors on the call too. So I know people hate to do intros and it takes time, but I do think that 5 minutes may be very important to people that's on the call. And that's for every meeting.
Okay. Thank you. All right. Other strategies to boost DEI? Sarah?
I really like the comment on the previous slide about facilitating a safe space. I don't know exactly how it was said, but knowing how to facilitate that safe space for people who are coming forward with difficult and vulnerable material, people who are, living with addiction or have been impacted directly with the issues that we're discussing. And I don't know if anybody has like recommendations for like trainings on, say like facilitation models that do kind of fall within that vein. But I think that there's definitely that's really important that we're not inviting people into a space to give feedback where, inherently we haven't done the work to make sure that we're facilitating that safe space.
That's a really good point.
I'm sorry, Sarah, can you repeat that? I'm trying to get all these notes organized. It sounded like you were saying, was that a concern or a recommendation? Can you rephrase that real quick? Or Blake, do you?
Yeah, it was a recommendation from
Okay.
the previous slide that she was reinforcing that, if we're going to ask people to come and share their experiences, then it needs to be safe for them, and we need to know how to do that. All right, Malika.
In regard to that recommendation, I mean, HCA is charged with teaching trauma-informed approaches. I've been stricken by how not trauma-informed this whole process has been. So when we're inviting people into conversation, I think that there's an assumption that people are always going to show up the same way. And when they don't, they are dismissed throughout the process. And it's not just like the one incident that a lot of people remember from the treatment work group in which vocal members showed up and, laid themselves bare in a work group and were told that they were off topic. But repeatedly, as we've brought people into these, conversations, because they don't use the same language that maybe other people do, then they are not valued in this process. And so I'm really hoping that there can be a process, for lack of a better way of putting it, the HCA checks itself and engages in some of the very things that they fund for other organizations to go through in order to learn how to better facilitate and engage with people that have been impacted by the systems that we're discussing. I feel like that's not a real big leap. Y'all are already paying for it for other organizations to engage with. And also that there has to, I would hope any DEI plan worth its salt would have guidance around how to engage with folks that are not part of the dominant culture. So I'm hoping that essentially that is something that can be shared with the SURSAC so that we can hold y'all accountable to it. And also would be something that y'all review and engage in trainings with your internal folks in order to, and I'm not saying this just to chastise you. These are like actual things that I'm hoping will happen. And it seems like there's some really concrete steps that are not too far-fetched for y'all to engage with.
All right, thank you. Okay. Anything else? And the trauma-informed approach, it is true. We do a lot of education on that. Anybody else? Like your hand still up if you want to. Okay, thank you. Anybody else on this subject? Anything else that we could do to improve diversity, equity, inclusion?
Can I ask a clarifying question?
Yeah.
So in the comments, there's been a bit of discussion around how it may be othering to use the term directly impacted. As an alternative, would it make more sense to simply open up for, public comment at the end of each topic discussion? So I want to honor, the voices of the committee members who, have been selected to be part of the conversation, but we also, it sounds like, want to have more opportunity throughout the meeting, throughout the discussions on the different topics for other people to provide their input. And so just wondering if the request is for like little mini public comment periods within each discussion, is that kind of what we're what the request is, or how's that landing? Otherwise, I'll just keep the notes as they are. That's okay. Thank you, Sarah. All right. I'll change the the language in that note there. Okay, Blake, back to you.
All right. So last call here. Again, we will take any comments from the group. If you think of something after the fact, we'd still like to hear it. Again, for those of you who may not be comfortable, speaking out loud or thinking about the topics that you want to discuss, those can come to us as well when you kind of sort those out. Love to hear them. So if nothing else in this section, we'll go ahead and move on to public comment. I know we do have quite a few messages in the chat if anybody wants to go back to those and discuss those. So if you wouldn't mind, please go ahead and raise your hand and we will call on you for public comment. You have 3 minutes for your comments. If you could help out with that, Sarah, that'd be awesome. Okay. All right. So first is Megan Tweedy. Please.
Hi, good morning. My name is Megan Tweedy. I'm from Yakima. I've been attending these meetings, I think probably close to a year. I have a couple comments I'd like to make. First is being from Yakima, I see that we have just one representative or one voice from Eastern Washington. Thanks to Amber from Walla Walla. I know Gina Mossbrooker, Representative Mossbrooker, is an alternate, but I'm wondering if there can continue to be outreach in the area of recruiting more rural voices. I think that's imperative. The second thing is, I think at the beginning, or just a reminder for acronyms, I understand it's, we all use them. People who are newer to this whole process, even just throwing it out one time, DEI, just having that time the first time it's said, because acronyms for a lot of people who are new to this can be confusing. My third point is I also represent the voice of those who have lost a family member to overdose. I have a lot of opinions on that, but what I also want to make sure is that, again, when a family member is attending that has lost a loved one, that we also kind of acknowledge that as well. And I think this does fit into that DEI overview, it can be very, very painful to speak out. I'm almost 3 years into this process, and I still get teary. I think public comment is very important. I also think staying on agenda is very important because people, as we know, are dying at unprecedented rates. So, you know, I understand. We want voices to be heard. We want all voices to be heard, and we also want people to stop dying. So we have to continue to move things forward. So I think public comment at the end and pausing when someone has shared that they've lost a loved one is really important. I think my 3 minutes are about up. I'm sure I have a few more things, but thank you, and thank you to those who are continuing to be outspoken in doing this work and making it meaningful. Thank you.
Thank you, Megan. Appreciate that. Okay, Deontay.
Good morning and Happy New Year to everyone on the line.
Hello.
I just wanted to reiterate something, and Hunter brought it up earlier, and I appreciate you acknowledging that earlier. But when we're talking about making space, and I hear your plans on DEI, and I hear all of these plans, but it's not going to work if we don't start to bring more people in the areas to the table. When you're saying DEI, you're working in the areas of bringing more diversity, equity, and inclusion. But when you look at the majority of the people that are actually on the committee, that does not look as such. I would love to recommend that you open back up committee recommendations or committee member recommendations. I never thought that I could be able to apply because I never felt like I was included. I was scared to do that because of, and we've talked about this, Michelle, we've talked about this, Michael. It's just, how can I bring people to the table when they're being silent and I'm being abused in this space? If the SURSAC is going to work, we're going to have to really work it. And if you need help, Michael, and if you need help, Michelle, it's okay to say that you need help in the space, because showing us diversity, equity, and inclusion slide does not work if you don't got no people in it. There's no LGBTQ representation. I see very few lived experience people in here. I don't see any tribal representation, to Lexi's point. And it's just, it's this process can be so great if we just have some humility in the space and say like, hey, well, we have this wrong. We can do better. That's why I come to these meetings every time, because I care. But I also know that there's a point of time where I feel like I'm not being heard or seen, and God knows I know that that's how my community members are feeling that are dying out there, that are even scared to come to these meetings because they feel this way. So again, Michael, Michelle, and members of the SURSAC committee, let's rehash this, because constantly we have like 89 people on the line that probably need to be included. And it's great to know that this process is available where people could be compensated, because a lot of the vocal members could not come because they'd be missing hours of work. So if you can walk us through that process, because we do have one vocal member on the line today, but I would like to also know the process of like how we could be able to bring that out to community. And I thank you. I thank y'all for the space, but we got to do better, y'all.
All right, thank you, Deontay. Appreciate that. All right, Lisa.
Sorry, good morning.
Morning.
I just wanted to offer an observation after listening to today's meeting, especially the discussion at the beginning. I guess I just want to ask or offer to our colleagues at HCA. I hope you don't take it personally people are worried that the urgency that Ms. Tweedy and others have referenced, related to the subject matter of SURSAC, people want to accomplish change. Almost everybody who's here, I mean, people have different reasons for spending time on SURSAC meetings, but very few people are spending time here without a very specific, deeply rooted reason. And everybody feels that where we are as a state is not where we need to be and wants to see change, right? So that's something that unites everybody here. And there's just a worry, I think, that it's not the work all the time and the effort that everybody put in, including yourselves at HCA, is going to add up to like less than the sum of the parts, because it's not landing in the legislature in a particularly effective way or in the public. And I just think that's good, that those sentiments are all really good, but you all are the gatekeepers to the process. And so that's all landing, it's coming at you and it's landing with you. But that's, I think structurally, it's a weird situation to have a government, division or department also vested with the initiation role in trying to create structural change. Like that's actually it's very unusual, and I don't know that it's unprecedented, but it's very unusual for that to be how it works. And I think unleashing the self-initiating, power of a lot of people who attend SURSAC and our members to move this agenda forward is going to be really, really important. And I don't think y'all can do that. This is something that Dr. Patinos was raising up in the last meeting too. We're going to need the self-authorization ability of the diverse sectors that are represented in the SURSAC membership and those of us who attend publicly to create the force and to advance this agenda. And I don't think it's no surprise that HCA, people are looking to you because structurally in SURSAC, you're running this thing. But for this next step, I don't know that you're best positioned to move any agenda forward, and people are anxious that all the time that you spend and that they spent may not land, and that is all understandable. So I hope everybody can kind of give one another the grace of structurally we need a different set of dynamics to move this into its next chapter, and that's completely understandable and it is not anyone's fault. So anyway, appreciate all of you. This is hard. It's just structurally awkward, but I do think that switching over to that community initiated push is going to be really important in this year.
All right. Thank you, Lisa. Appreciate that. Mark.
Yeah. Hi, everybody. Mark Cook with
Hello.
ACLU Washington. Happy New Year. Can you hear me okay? Okay. Sorry. This computer can be quiet sometimes. Yeah. No, I just thank you to everybody for being here as my first comment, particularly people with lived experience. This is an intimidating, hard space, and just want to give my thanks for people that continue to show up and be a part of this because it's important. And I hope SURSAC can grow and continue to improve. Two quick comments. So in terms of the plan itself, if there's a way to put a draft of it online or something, I think that would be really helpful. A lot of lawmakers don't know anything about SURSAC, to be honest, in our conversations. And there is a lot of media around Blake decision and on drug policy, and SURSAC is not breaking through. So I realize the recommendations are up there. That's very helpful, but having the plan, right? And that's what it's called in the legislation, is there's supposed to be a plan, right? Heading into this legislative session, I think is really important. There's a bill this afternoon that is being heard, House Bill 1006 on drug testing equipment, which is exactly on point for SURSAC. And I don't think a lot of people know about that. So the legislative session is off and running, and I think SURSAC's work is really important, and I hope lawmakers and the public and other interested people get to hear about the wonderful work that has been done. So that's my one comment. I do have a question. I realize this is a comment period, so I don't know if it can be answered, but I'd really like to know more about what executive review means. That's kind of a generic term. I don't know if that's like copy editing or it's hard to get visual graphics done from HCA. My concern is that it's a political review, and these delays really do impact the legislative session. So if there's any clarity that can be brought forward about what executive review means, I think a lot of people, including myself, would appreciate that. Thank you.
Okay. All right. Any comments back there?
Yeah, Mark, this is Michael. Executive review just means it's in the executive branch for review. And so that includes both the department and the governor's office.
Okay, Susan.
Hi, thank you. My comment, I'm Susan PC. I'm the Recovery Navigator manager for King County, and I just wanted to put my comment in. It kind of relates to earlier in the agenda, but when looking at the effectiveness of RMP, I really just wanted to hold up the idea that I really believe it's important to take a step back view and realize we don't have the opportunity to really have the statistics that maybe other programs would have in looking at its effectiveness, its usefulness, and its value. And that I really think that right now the main objective is really to look at those success stories and look at the success of how much was built from nothing to something in a relatively short amount of time when you take in the consideration of the entirety. I also just wanted to hold up one other idea, and that I really would like to continually to hear the idea of reframing to harm reduction, and that is that when we are holding up an individual, a participant, that the health quotient of the entire community is increased, and that we are healing the entire community when we reach out to an individual, and that is the honoring. When we talk about people with lived experience, we're really talking about honoring a coming from and to the community being stronger. So that's where I will leave that, and thank you.
All right, thank you, Lisa. Thank you, Susan. Sorry, appreciate that. We still have Deontay, Lisa, and Susan with your hands up. Any more comments? All right, thank you. All right, Leo.
Wow, I wasn't expecting to go so quick. Okay, I'm gonna just go ahead.
Oh, you're muted yourself.
Now.
I'm going to go ahead and share real quick a little bit of my background in the chat. But I was recently speaking with Alicia Friedkin, who works with the Indigenous Policy. She's the Indigenous Policy Lead at Provincial Health up in BC. And she had talked about the power of having people come out of the closet who use drugs and how significant that is. And I think that when we talk about the power of storytelling and how a lot of folks have given feedback today on the power of media and how you really need to get ahead and plant those stories and kind of be aggressive in planting those stories, I often think about kind of selling the commercial of all that and what kind of commercial would make the most difference. And I think about, you know, it would be very powerful. When I had spoken with Alicia, she had talked about people in the BC government coming out, and she said, wouldn't that really affect the impact of stigma when we think about how silencing stigma can be in terms of perpetuating shame when we look at substance use? For any people that you can gather from the Washington state anywhere to really come out of the closet. And I could just see this commercial that says, I do drugs and I do drugs. And maybe it doesn't list their name, but it's normal everyday people that are businessmen and businesswomen and wearing suits. And if there was just a pattern of people saying, and I use drugs and I use drugs, to just kind of normalize the fact that a lot of us are using drugs and culturally sanctioned drugs, and this society applauds it. The other thing I wanted to mention was that it seems like reaching out to communities like the Office of Public Defense, where I used to work, and maybe you guys already are, but in terms of reaching out to those folks whose lives are directly impacted by these laws that are so racist and so classist, or reaching out to a chemical dependency treatment center to try to reach those folks that are currently in treatment, and reach out to local tribes as well. It seems like a lot of these things have been mentioned, but when I think about people coming forward who want to tell their story, I think we have these concepts around ableism and professionalism that are often steeped very much in racism and classism. And so it's just vital that we kind of look at, is it okay for someone to lead who is actively in addiction, and we have people within our organization who are currently, locked up in different systems. And so I think it's very vital that we kind of stop empowering those who look nice and who act nice and who don't have neurodivergence or who don't have a personality disorder and things like that. Because I think there are lots of us who can lead who have issues. And I think the more transparent we are about our issues, the more transparent people will feel about taking away the barrier and the stigma of addiction. Thank you.
Thank you. Appreciate it. Any other comments? Any other public comments? We have a couple more minutes. All right, last call. Okay. All right.
Sorry, can I, this is Lisa again. I just thought of
Yeah.
something based on what Mark said, and maybe this is what you were saying at the beginning of the meeting when I tuned in like 10 minutes late, but I do think if HCA could just alert the distribution list of people who get SURSAC notices of relevant bills coming up, hearing dates and opportunities to testify, I think that could actually gather up a lot of this momentum without you doing the advocacy. You creating awareness of those bill opportunities could allow others to organize for opportunities that we may otherwise miss. So I'm thinking there's a lot of like probably low hanging fruit, like drug testing, and we need to make the wins we can make. So I think people are just not organized to notice those opportunities. So if you can just alert folks, that'd be a huge service.
All right, thank you. See, shaking heads. Are we gonna do that, or we have a method? Okay, we have a way to do that. All right, perfect. Great. Okay. Any more comments?
And
Okay.
real quick, if there are, I want to make sure we've got all the comments, but after that, it looks like we will have time to actually do some agenda setting for the next
Hey,
meeting.
that's what I was thinking, the same thing.
Right? Okay, great.
Yep.
Just want to make sure that we've got all the comments of folks that want to comment first. Yeah.
Yeah.
And Blake, just to reiterate what I had said earlier too, that Michelle has a plan to get out the information about it as bills as we see them come forth and so forth. But if you all see something and you don't know that we've seen it, or don't see it on the list that we send to you, let us know. Things move very fast, particularly this first 4 to 6 weeks. So please let us know, and we'll do our best to let you know. Thank you.
Okay. Hey, Michelle, you want to lead that conversation about next meeting? I know we have one thing on the agenda, but as for the rest.
Right. Yeah. So let me just pull up this slide here. So yeah, we've got the RNP presentation with Ryan Keith and Suzanne Straub. But otherwise, the February agenda is wide open. So what would you, SURSAC members, like to talk about? And then if we can talk about who else needs to be invited to that conversation in addition to the committee members. Oh, Megan, RNP stands for the Recovery Navigator Program. Sorry, I forget how many acronyms need explaining.
Got a couple of hands up.
Hey, Michelle.
Julian?
Oh, Sorry, real quick. I wanted to let Brandy know. Brandy, when you get to a safe place, your camera's on. Just a heads up. Okay, go ahead. Sorry about that.
Thanks, Tony. Julian?
Yeah, I hopefully the report will be out and we can talk about, get feedback on that, right? For that
The
meeting?
report will be ready for review in March. So that's the meeting set aside for the first Recovery Navigator quarterly report review. Yeah.
Gotcha. Okay.
Yeah, this presentation will be an update on the work so far and just clarifying for everybody who doesn't feel quite familiar enough with the program, like what exactly it is, how it's operating, and those kinds of details, just so that when the report time does come, everyone is familiar with what the program is and how it operates.
Thank you.
Julian, were you referring to the RNP report or the SURSAC report?
SURSAC.
That's what I was thinking. That's all.
Oh, I'm sorry.
Yeah.
Sorry, Julian. Okay, yeah, thanks, Michael, for clarifying. Right, so that you want to add the review of the final plan to the agenda, is that right?
Yeah.
Okay.
And how to support it.
All right, we've got some emerging legislation here, state supply, relevant bills, legislative update. These are from public and SURSAC members. So would it be possible, and I'll ask the question, if the group wants it, to make this a regular part of the agenda? We're just talking and reviewing what we're going to do for next time. All right, she's shaking heads here, so hopefully we can make that happen. Malika?
It came to my attention that there was potentially going to be a presentation about housing going forward, and it would be interesting to learn more concretely how our recommendations are going to intersect with programming that's already occurring. For example, foundational community supports, because in the State of Reform conference that happened last week, one of the main things that really stood out to me was that permanent supportive housing is one of the greatest areas of need. However, the only recommendation that got a lot of traction out of this particular group was to increase funding and availability of Oxford housing and Walker housing, recovery housing, not the full spectrum of housing. And that was a point of contention, at least for me, through the process. So I'm wondering if we can hear more from Commerce, Department of Commerce, about ways that our recommendations intersect with what's happening and how they will improve or don't have the potential to improve the condition of people that need housing along the whole spectrum. Also because there's going to be investment bills put forward by the legislature around housing.
All right, thank you. Apple Health and Homes with Melody. See that on there?
Yeah,
Sorry,
I just add that any of the program areas, folks, that we work with that you want to know more about, housing or others, this is perfect. Thank you for bringing that up, Malika, because we can surely bring that in.
Malika, your hand's still up. You good? Thank you. Okay. Anything else?
Yeah.
I guess, Michelle, you can go
Yeah, I
ahead
see
and wrap us
Sarah's
up.
I see Sarah's comment she was recommending that next meeting we discuss making one or more of our DEI and other process recommendations actionable in the near future or as a standing item. It sounds like folks want to have public comment at the beginning, like maybe we can do 10 minutes at the beginning, 10 minutes at the end, and then be inviting public comment throughout the conversation as well. So I'm not sure if that's something to implement, to automatically, from this point forward, or if we need to discuss that further. But a lot of this can be implemented right away. So I can provide a summary of that, what needs further discussion, what we can do now. So hopefully that will help to serve as a follow-up around that, but I'll make a note here as well.
See, Scott's got one more comment in there as well.
Yeah. Oh, great. Okay, so foundational, that's what FCS is, foundational community services, can provide an overview of supportive housing services, which are a component of the Apple Health and Homes program, HB 1866 from the 2022 session. All right, great. Yeah. So looks like a big part of the next meeting will be talking about about housing. So we'll make sure those folks are there. Any other people that you want to make sure that we invite to that conversation? All right.
Time to wrap up.
I think we can wrap up a little early, yeah. So thanks everyone. This is great to have our agenda, already populated here. Next steps, meeting notes, sending out the agenda in a couple weeks for review and additional input if you've got it. And we'll also provide a summary of the DEI strategies that we discussed and where action is being taken, where more discussion may be needed. And I think that that wraps it up. Also in the newsletter, we'll be doing our best to summarize bills of interest, both in direct emails to SURSAC members and in the newsletter. So I think that covers it.
Michelle, I'd also like to thank folks for being on today. Really appreciate your contributions and for speaking up as Blake walked us through that. If there are folks that this format is not comfortable to share your thoughts, and please reach out to us. We do want to hear from each and every one of you that are on the panel. So please reach out if this didn't work for you in this format today. So thank you all. Have a great start to your week.
Bye, everybody.